John is a beautiful baby boy born to a woman living with HIV somewhere in sub-Saharan Africa. Ideally, Mary, his mother, should get an immediate HIV test and result for John to ensure that if he has HIV, he gets treatment as soon as possible. That is not what happens in most places where HIV-positive mothers have children. In 2020, it still takes approximately 55 days for a caregiver to know the HIV status of their child. Why? The test that we mostly use to diagnose children is often placed in a large hospital, far from people like Mary, and requires the smaller clinics to bring samples for testing, which might take days and sometimes get spoiled on the way. Then once the test is done, the small facility where Mary is getting treatment is contacted and they collect the results, then start the hard task of contacting Mary, who probably lives miles away from the facility, has no phone, and has challenges with transportation to come back to the facility to receive little John's results. You would be surprised to know that in contrast, if John was an adult, he would be able to get immediate testing and same-day treatment at the same facility baby John is not. You will also be surprised to know that there is a better testing method that allows baby John to access same-day testing. But why does he not have access to it? Because most funders of the HIV response consider it too expensive. Should John be HIV positive, Mary faces the additional struggle of getting treatment for John. If John does not get access to treatment, he is likely to die by the age of 5. As a woman born, raised, and still living in a continent that has high health inequities, I am no stranger to the challenges of seeking basic healthcare and not receiving it. But when I think of my childhood, I remember always being able to access immunization and treatment for all ailments I had, but in my work as an activist, I realized every day that that was a privilege and not the reality for most children, especially those living with HIV. In the world today, there are 1.8 million children under the ages of 14 living with HIV. Approximately 180,000 are newly infected each year, and 110,000 die each year of HIV. Our children are still dying. That was a slogan our partners and us have used for the last 1 year to highlight the dismal progress in the HIV response on pediatrics. For over 30 years, we have made great strides in the HIV response for adults, but research, diagnosis, and treatment have left our children behind. Children must be entitled to the same quality of care as adults. That should not be a privilege, but a responsibility. For most of my adult life, I have always been a passionate advocate for equitable health access ever since the first day I worked with displaced women who had lost their homes and access to healthcare after the Kenya general elections in 2017 due to violence. That changed the course of my life from aspirations of being a practicing lawyer to being an activist fighting for justice and human rights. Today, I work with a global network of activists who work tirelessly to ensure access to health in their communities, and I am privileged that I get to add the experts in this fellowship to that list. When we began our journey in this fellowship, COVID-19 also began to shape the future of our advocacy and our fellowship as it took hold in our countries, and the devastating effects of the pandemic not only served to highlight the importance of our work, but also stood testament to the importance of responding as a community. I remember in the middle of the fellowship incorporating the effects of COVID on access to services for pregnant and breastfeeding mothers to my work, because lockdowns and curfews had greatly exacerbated the already existing barriers to health access. From this fellowship, I have gained a community of experts and mentors that I will be taking with me, even after the fellowship, who will continue to fill my toolbox with a movement of leaders who are incredibly placed to shift the inequities in the world currently. I am especially grateful for the lessons on partnership and collective action that have always been vital to change, but are even more needed now when COVID-19 threatens to ravage our communities and our healthcare systems. I take away important lessons of how connected the world is and how important it is to bring our expertise, experience, and knowledge together for collective action against health inequities in all forms. I believe in the power of community to make change required, that solutions to our challenges are possible when we work together. To the fellows, as we come to the end of the fellowship, I am confident that the tools of advocacy, activism, leadership, knowledge that we have gathered this year make the future bright. As we go back to our community, I am sure that it is not lost on us the hurdles that we will have to face as we continue to strive for a world with less inequities. But I feel empowered with superpowers to better organize, have collective action, and build ownership and leadership to not only shape advocacy on pediatric HIV, but a host of other topics, including but not limited to COVID-19. Thank you.